Joins us now, and she's one of the women doctors leading the charge on hormone therapy. As always, good to see you. So we see the video of women with hot flashes and insomnia. That is what I vividly remember seeing growing up on TV, right? And sometimes those symptoms are made to kind of sound like a joke, like, oh, if you're hot, you must be going through menopause. But how can this really impact women's heart health?
It's so important to understand this because it really isn't a joke, and we've kind of treated it that way, and it's something that we should suffer through, this lexicon of suffering. And we need to stop normalizing that, because what we know now about hot flashes, and the new term for that is hot flushes, is that those can be a correlation to heart disease. In fact, the intensity and the duration of these hot flushes can absolutely be related to heart disease, and Black women tend to have more of these, and so therefore a higher risk of heart disease as well. When we look at insomnia, sleeplessness independently of menopause is a risk factor for heart disease. And yet this is one of the symptoms of menopause. In addition to that, you can see an increase in your cholesterol levels just over a period of 2 or 3 years. Hypertension can begin to increase. All of these are risk factors for heart disease on their own, and they begin to happen all at once during menopause. And so we cannot sort of laugh this off any longer. We need to understand what's happening to women during this phase in our lives and begin to dial back the information on menopausal hormone therapy or hormone replacement therapy.
I think what is so difficult, and I'll speak for myself here, it is so easy to explain away symptoms as a woman, right? Whether we go through it every month, whether we get to a certain age and we're like, okay, what exactly is going on? And we can easily just say, you know what, I'm not sleeping right now because I'm stressed at work, I'm stressed at home, all these different things, right? So at what point, I guess, what is the threshold that you should say, you know what, okay, I probably should see somebody, because there's early menopause and you have to be a certain age necessarily anymore.
That's right.
So when do we seek that help from a doctor?
You know what, Alex, those are such good points. We have no information, right? We're taught the birds and the bees, but we're not taught about menopause. And the symptoms can vary. And not only is it insomnia and restlessness and maybe irritability and brain fog and these hot flushes, but there can be other symptoms that are not well known, because you can begin to have bone loss as your estrogen levels decrease.
And how do you even know that's happening?
Right. and you can start to have pain. You can have something called a frozen shoulder. You can have itchy ears because your skin is drying out and you don't really understand it. It's not well described and it's not well discussed, and part of that is why, because women are not included in clinical trials. We don't have research that's focused on women's issues. Most of clinical trials are still led by men, and those are the indications. And we've got to begin to focus especially on menopause, because menopause is a cardiovascular risk factor for women. In fact, your risk of heart disease doubles as you're going through menopause. Your risk of heart disease compared to men is half that of men prior to menopause. And once you enter menopause, it equals that of men. And by the time you're 70, our risk is even greater than that of men. And heart disease remains the #1 killer of women in this country. So we cannot continue to ignore menopause, because menopause is increasingly being recognized as a risk factor for heart disease.
Yeah, or just gloss over it as, you know, like you said, suffer through it. You just kind of grin and bear it and say this is a part of life.
That's right.
All right, let's talk about menopausal hormone therapy, or MHT, and how does that differ from hormone replacement therapy?
So Alex, another good question. As you can tell, all of this information is evolving. You gave a really nice intro, but all of this is confused by the Women's Health Initiative that was done 25 to 30 years ago on this large group of women, and the conclusions drawn from that study all were erroneous. Unfortunately, it shut down hormone replacement therapy for women at that time. So as we're beginning to look at it again and dial this back, and even the Women's Health Initiative has retracted quite a few of their statements on this data, the terms are changing. So hormone replacement therapy is an older term, still in use, Menopausal hormone therapy is the more updated term to mean exactly the same thing. So HRT and MHT are equivalent, older term, newer term, sort of like hot flashes, hot flushes.
Okay. Wow, this is a lot of information,
Yes.
but we have to start somewhere, right?
We do need to start, and we need to begin to talk about it, because increasingly I'm becoming convinced that menopause needs to probably lie within the field of cardiology, because there's so many cardiovascular risk factors, and women of color are increasingly at risk. In fact, Black women tend to go into menopause a year and a half earlier than white women for a number of reasons, and that means even your risk of heart disease starts a year and a half earlier. So we've got to begin to really drill down into this, because it's really a crisis in this country. And when we talk about maternal mortality, it's all wrapped in to the whole transition of women as we beautifully go through our lives in all the different phases.
I love that. Beautifully go through our lives. All right, Dr. Morgan, always good to see you. We'll be right back.